Well, I'm a surfing writer by trade, which is a pretty unusual profession, and it's been a bit of a dream job in a lot of ways. You know, I often say I was kind of living the dream, you know, travelling and surfing and writing books about some of my heroes and a beautiful family, 2 young kids, living close to the beach. No complaints at all, you know, life was really good. And I distinctly remember having this thought like, you know, I think I have pretty close to a perfect life and I'm really grateful and I don't need any kind of wake-up call. You know, I really appreciate it. But of course, life doesn't always work that way.
Queenslander Tim Baker had just celebrated his 50th birthday when the results of a medical checkup brought his whole world crashing down.
I remember the date was July 7, 2015. I was diagnosed with metastatic prostate cancer, which means it's sort of spread to the bone. Oncologists are pretty coy about giving definitive prognosis because, you know, they sometimes get accused of, you know, pointing the bone and, you know, seeding a self-fulfilling prophecy. But I was given the message that I could expect 5 years of reasonable health and that 6 would be exceptional. It felt like being smashed in the face with a baseball bat. I could almost remember a sense of like this physical force of just being belted in the face. And, you know, it's almost like one of those cartoon scenes where, you know, there's birds flying around and your eyes are rolling back in your head. I just felt so sort of sideswiped by it. And it took a long time for that sort of to really sink in.
Tim was completely blindsided by his diagnosis. But as he commenced a daunting combination of chemo and hormone therapy, he began to focus on doing all that he could to improve his outcomes.
I know it's a really loaded term these days to kind of like do your own research, especially when it comes to, you know, medical matters. But I guess being a journalist, I felt like I had a reasonable idea what were kind of credible sources and what weren't. I remember one of the first thoughts I had was to navigate this path ahead, I was going to have to be able to kind of quieten the anxious mind. And so meditation became really important. And then I overhauled my diet pretty much instantly. And exercise, I learned, is just super important for men going through treatment for prostate cancer because hormone therapy, you know, it affects bone density, muscle mass, cardiovascular health, you know, heart health, all these things. And exercise is kind of the perfect antidote. I came up with my little self-care mantra, which is, you know, I've just got to remember to take my meds, MEDS, and that stands for meditation, exercise, diet, and sleep. And they just sort of became the 4 pillars of my self-care. I just thought, well, if the prognosis is just based on a general population, there are no statistics around 50-year-old surfers who immediately transition to a plant-based diet and meditate like a monk and go surfing and do yoga and all these things. And yeah, for some reason, I just had this strong confidence and belief that I could do a whole lot better than, you know, what the medical mainstream would suggest.
8 years on from receiving his dire prognosis, Tim isn't just surviving. According to his doctors, he's thriving.
I'm still getting a really good response from the frontline treatment of hormone therapy, which is a great result and I think quite unusual. I've been lucky enough to use hormone therapy intermittently to sort of help mitigate the side effects. And so I feel really well. I'd still surf and travel and write and, you know, I'm a pretty active parent and all that kind of thing. I feel genuinely joyful most of the time, which is a lovely state to live in.
Melbourne oncologist Dr. Arun Azad said there's no question Tim's meds mantra has improved his prognosis.
For many patients, their treatment of their cancer just revolves around drug treatment, and that's understandable because without the drug treatment for metastatic prostate cancer, they're not going to get good outcomes and they're not going to survive. And sometimes I think even as doctors, we focus, you know, too much on that or just on that. But it is very important to look at the other aspects of patient care, and that includes self-care. Tim, by adopting these other lifestyle approaches, has been able to cope with the side effects of treatment and the burden of having a cancer diagnosis and therefore remain on the treatment for longer and therefore benefit. So it's absolutely been crucial to his outcome that he's been able to make these life changes over his journey of prostate cancer.
I mean, I feel incredibly grateful that I'm still here. You know, I have these quite unusual conversations, like with my GP, for example. I said to him recently, you know, this is all quite strange. Like, I didn't even know if I'd still be here. And he paused and looked at me and just looked me in the eye and said, I didn't think you'd still be here. I guess my simple message to doctors is, when you're prescribing hormone therapy to men with prostate cancer, prescribe exercise, prescribe nutrition, you know, refer men to men's sexual health specialists, you know, provide that sort of supportive care that's going to help them have the best shot of good quality of life. You know, I trust in medical science to continue to come up with better treatment options while I keep myself in good nick in the meantime.